Religious freedom is still in danger. That's how Christian groups are describing the latest change in a government mandate. This is the Citizenlink report. I'm Stuart Shepard along with Carrie, Earll, who is our Senior Director of Issue Analysis. Hi, Carrie.
Hi, Stuart.
We've all been hearing about this. We're trying to figure out what it's about, and that's why I wanted to ask you on today, just to help us understand this whole thing. The government has come up with some requirements for health care, specifically health insurance, the kind that you would get through your employer, and Christian groups are saying that there are some things in there that go too far. Help us understand what it's all about.
Well, this is something we've talked about before on Citizenlink Report, and it has to do with the new federal health care law, which requires preventative services, which would be contraceptives, sterilizations, and drugs that may cause abortion, to be part of health care packages that are offered to employees. Okay. Now, religious groups have a problem with that. And they've been complaining to the federal government saying, hey, we need an exemption on this. So the federal government has announced it's making an accommodation. The problem is the problem's still there. It doesn't include more exemptions. Originally, who's exempt would be churches, seminaries, religious orders. Those folks are still exempt, but there's a long list of folks that aren't. And these would be religious, either nonprofits like a hospital, a university, adoption agencies, maybe your pro-life pregnancy center down the street that works to end abortion, for-profit groups like Christian radio stations, TV stations, bookstores, but it also affects people of faith who own businesses, who run companies, and doesn't give them any kind of exemption either.
Yeah, whether it's a dry cleaner or a paving company or whatever.
Exactly. If you have a value here, you have to still pay for this and provide it. So the accommodation that was announced is really a tweak in the mechanics, in the how-to. It doesn't remove the you must do it, and that's the problem. But you know, fundamentally here, this isn't about contraception and abortion. It's about whether the government can mandate that religiously affiliated organizations have to provide drugs and surgeries to their employees that violate their deeply held religious beliefs. You know, pregnancy is not a disease. Providing free access to drugs that may cause an early abortion is not health care, and religiously affiliated groups should not be forced to have to do this. We think that's wrong.
Now, I want people to hear how the president phrased this and how he couched it when he talked about it. We're going to play a clip from an announcement he made about these accommodations that Carrie is talking about and let you hear it for yourself.
The result will be that religious organizations won't have to pay for these services, and no religious institution will have to provide these services directly. Let me repeat, these employers will not have to pay for or provide contraceptive services. But women who work at these institutions will have access to free contraceptive services, just like other women.
So we don't have to pay for it.
Well, you know, you've heard the saying, there's no such thing as a free lunch.
Yeah.
Well, there's no such thing as free contraceptive surgeries and drugs either. Somebody has to pay for this. And in reality, it is the premiums of that insurance policy that pay for the coverage. And the premiums are paid by the employer and the employee. So what's going to happen here is the insurance carrier is going to increase the cost of that policy because someone has to pick up the cost of those extra benefits. And then those premiums will then be paid by the religious employer. So it's a bit naive to imply that religious employers are not going to have to pay for this. It's the same thing with providing, because that employer providing that health insurance is still the mechanism by which the employee is going to have access to the drugs and surgeries. That doesn't change. That employer is the conduit, if you will, to that. And I want to stress again, Stuart, this is not about access. Women in America have access to contraception and to abortion, whether it's surgical or chemical. Yeah. This is about making religious employers pay for it.
Pro-life employers, we might point out.
It could be pro-life, you could be any faith, you could just have a moral problem with providing these, and there's no accommodation for them.
Now, this, I think, is somewhat analogous to, as I try to understand it, when I go fill up my gas tank at the gas station, I get a receipt. There's no tax listed on there. It's hidden in the cost. They don't spell it out. It's added in a place where I don't see it, and that's part of how it works. Or if you go grab your last pay stub and look at that, on there is an amount that you pay into Social Security. But guess what? That's not all that gets paid into it. The employer also pays part of it. It's hidden from you. You don't get to see it. But that doesn't mean your employer is still allowing for that money to be paid in and adjusting your salary accordingly. Right. With this, the insurance companies, they say, well, they'll pay for for it, but we know that that money still has to come from somewhere.
It has to be paid, and that's what people are really still up in arms about, is it doesn't matter if it's an accounting change in how that money gets someplace. The bottom line is religious employers are still going to be required or have to pay a hefty fine under this policy to accommodate, to provide, to distribute, to be a conduit for drugs and surgeries that they have a problem with.
Now, a big concern here, and you've expressed this a bit already, is how the government defines who's religious and who doesn't exactly qualify as religious.
Well, it really steps over the line here. This is a huge power grab by the government, because the government now is defining religious freedom. The government is now defining who is religious enough to qualify for that, and that really takes us to a new place here. You know, if this policy stands, religious freedom is going to move down the list of protected rights, and it will be right behind abortion and contraception. This is going to put abortion and contraception above religious freedom in this country, and that is not what I think the founders had in mind when they wrote the free exercise clause to the First Amendment. When you look at this, this is really a power grab, because government does not define who we are. Government does not define our faith or what is included in our religion. That is the role of the church. There is an appropriate role for government, but this ain't it.
Yeah, and one of the changes in language that we've seen, that we've noticed in speeches by Secretary of State Hillary Clinton, for example, is instead of talking about freedom of religion, they talk about freedom to worship. And that puts it in a whole different category. It's the idea that you can be free inside the walls of your church to talk however you want, but when you come out here, we're the government and we'll tell you how to think.
Well, it really does limit to force people to only be practicing their faith in those four walls of their church or their synagogue. Yeah. What we have to remember here is this applies across the board to people of faith, not only to recognized religious entities, but also to that business owner, the person who runs that company. They're going to have to provide these as well. And it reminds me of what's happening, for instance, with wedding photographers and caterers who are being forced to accommodate same-sex ceremonies, or faith-based adoption agencies that have to close their doors if they won't place children with same-sex couples. This is another example of a very serious breach of our religious freedoms that's happening before our eyes, and we need to be watching what's going on and be involved.
All right. Well, thank you, Carrie, for your insights. Appreciate you keeping track of this for us and helping us understand how government and religion are going head to head here. And thank you for watching. We always love hearing from you. We read every note that comes in. You may always write to us at mail@citizenlink.com with your questions, your comments, your criticisms. We're open to all the above. We encourage you to pray for the protection of our First Amendment freedoms, specifically the freedom of religion, the freedom to practice our religion in the public square and to express our religious point of view in the public square. And remember, stand tall and be heard.